As with other assessments, the assessment of the respiratory system is a lot on your own. Again, it should be a review. You are responsible for reviewing both the anatomy and physiology and health assessment of the respiratory system, pages 473 through 488 independently. I will be covering diagnostic assessment, imaging assessment. Chest x-rays they're usually written chest x-ray PA and lateral, are used to assess lung pathology such as pneumonia, atelectasis, pneumothorax, or tumors. A CT scan are used to assess for cross sections of soft tissue and can be with or without contrast to enhance the visibility of tumors, blood vessels, and the heart chambers. It is the nurse's responsibility to ask if the patient is sensitive to contrast dye, allergic to shellfish, or iodine. Contrast medium can be nephrotoxic. With that being said, you always want to check your kidney function test prior to the exam. Metformin, a medication used for type 2 diabetes, should be held for 24 hours prior to and not restarted until adequate kidney function is confirmed. Non-invasive diagnostic assessments. Now, I know very well that they had pulse oximetry on there, but by this point in your nursing school career, you should know what that is, so I did not add that. I did add the exercise testing. It's used to assess the patient's ability to work and perform activities of daily living. It's usually performed on a treadmill, bicycle, or maybe a self-paced walking test, and they're looking for shortness of breath, weakness, and ability to continue to speak independently. Pulmonary function tests are used to assess lung function and breathing problems. The test measures lung volumes and capacities, flow rates, gas exchange, airway resistance, and distribution of ventilation. These results are interpreted by comparing the patient's data with expected findings based on their age, gender, race, height and weight, and their smoking status. A lot of times these tests are done for patients who have new onset of pulmonary disease so that they can use these findings to later compare findings as the disease increases. They also will use pulmonary function tests for patients with known pulmonary disease prior to surgery to see how well the patient will tolerate surgery without lung complications. Exercise testing is used to assess the patient's ability to work and perform ADLs. It can be done by either a treadmill, a bicycle, or a self-paced 12-minute walk. The exercise in a patient with normal function test is limited by circulatory factors. Whether or less exercise in the pulmonary patient is limited by breathing capacity and gas exchange, or both. So they will do this so that they can see how well the patient is able to tolerate doing activities of daily living independently. Invasive diagnostic assessments. Endoscopic examinations, including bronchoscopies, is the insertion of a tube into the airway to view airway structures and to obtain tissue samples. Lung biopsies can be done several different ways, including during a bronchoscopy, where they actually, when they're taking that tissue sample, will go to the top of to that right bronchus and be able to get lung tissue and be able to assess it that way. An open bronchoscopy, an open biopsy is done in the OR because that's where they would actually make an incision into the skin and take a biopsy of the lung. A percutaneous lung biopsy is done in radiology or interventional radiology under fluoroscope or CT guided, so that the interventional radiologist is able to then get the biopsy during the fluoroscope procedure. A thoracentesis is the needle aspiration of pleural fluid or air from inside the pleural space for both diagnostic reasons or to remove fluid for comfort as well. You want to make sure you're looking at the risk of a pneumothorax for 24 hours after a patient has a thoracentesis. So make sure you take a look at page 493 where it talks about the symptoms of a pneumothorax that you would want to make sure the patient was aware of. It can be pain on the affected side, increased heart rate, increased shallow respirations, a feeling of air hunger, again, that deviated trachea, and a new onset of a nagging cough. And what we do is we instruct them to go to an emergency department immediately if these symptoms occur. I hope this brief review or brief introduction to diagnostic assessments will come in handy. We will still continue to talk about them during our lecture on both infectious and non-infectious pulmonary disease. But I wanted to kind of take that time to look inside this assessment chapter at the diagnostic assessments so you know where to locate more information on diagnostic tests that you may see on your clinical units.